What's up, everybody, and welcome back to the podcast. My name is Robbie Cassidy, and on this episode of the podcast, we are going to change it up a little bit, and we're going to look at a fictitious, not so fictitious character called Tony. And the reason that it's a fictitious character, but also not a fictitious character, is because it represents us all when we get an injury that keeps coming back. And I'm going to use this idea, or this story, to help describe why you need to stop looking for new diagnosis, okay? Because what will happen is, you're going to hear me talking about it, but anyone that I'm dealing with that comes to me, especially with back pain, has generally had 3 to 5 diagnoses before they come to me, and they're able to rattle off all of the things that are wrong with them. And oftentimes when you look at the diagnosis, they're just given signs, like random signs that may or may not be associated with the issue that they're dealing with. And then they're told, that's your diagnosis, so you need to fix that. Like really common ones would be overactive muscles, or it could be your posture is off, or you have flat feet. So there's loads of them that they give to people, and then they say, this is the reason that you're dealing with an issue. But I'm going to talk about why that's not the case. And I'm going to talk about why we need to start to look differently at a recurring injury and at a chronic injury, and how you're not going to be able to get a specific diagnosis in a way, but you actually can get a specific diagnosis. Hopefully that makes sense. What I mean is that there's not a diagnosis a lot of the time for a chronic or recurring injury, and that gives you the power, because that's how you can actually fix the issue. Because you don't look at the signs and the symptoms, you look at the underlying issue that's going on. And when you start dealing with the underlying issue, then you can fix it. That's the case with it, really. So to talk into the story of Tony, okay, let's just look at Tony arrives to his doctor, okay, and he's dealing with a back issue, one that's going on for a long time. It's a lower back issue. There's a funny thing about this Tony character is, as I say, he's a fictitious but not so fictitious character, because he represents a lot of the people that I work with. And in many cases, I've named him Tony because it could be a girl or a guy, because there's a couple of cases that are top of mind, and hopefully if they're listening to this podcast, they'll be able to resonate with it too. So what we're doing is, Tony goes to the doctor. He has a back issue. Now, this back issue has been flaring up and giving him pain for the last year or 2 years. And he's been given the diagnosis before that it was flat feet. It's because he was running. He's also been given the diagnosis that his glutes aren't firing, and that it's posture-related pain. Okay, it's because his head posture is forward. But the thing about it is, the diagnosis that he's given don't line up, because when he works on those, the flare-up goes away, but then he gets it back again. So does that mean he has a new injury every time? Well, let's dig into that a little bit more. So Tony goes to the doctor, comes back. He looks for new diagnosis because he's thinking, this couldn't be the same thing as it was last time. I'm getting really high levels of pain. It's scary. If it was the same thing, I fixed the last issue. I don't know why it's happening again. Now, first off, when he got the last diagnosis of, let's just say his most recent diagnosis was glutes aren't firing, and he was given the exercises to do it, to fix the issue, or to work on the issue and to get the glutes firing. I don't know how the man was standing up, to be honest, because if your glutes don't fire, you're not able to stand up. But let's just skip over the fact that that's a possibility, and let's not rationally look at that aspect of it, and let's just focus on, okay, well, the glutes aren't firing, because I'm obviously being sarcastic there, because some of the diagnoses that people get, just they make rational sense up to a point, and then they just cut off that rationality. They stop thinking any further on it, because they just think, okay, well, that's obviously the issue then. So glutes aren't firing. Don't know how the man can stand up, but anyway, he gets in there. Now, the thing about it is, Tony has a habit of, when he gets an injury or an issue, and when he goes to the physio, he's a really good habit, or bad habit you could say, of not doing the exercises that he's given. So he'll go in, he'll get the diagnosis of it, glutes are firing. Then what they'll say is, because your glutes aren't firing, your core is also weak. Okay, perfect. So let's give him core exercises, and let's give him glute exercises. So Tony goes in, comes out with, and many of you can probably resonate with this, he gets a dead bug, he gets a bird dog, he gets a cobra stretch, and he gets a single leg glute bridge. The thing about Tony is that he's not too keen on doing the exercises for too long. So he does them the first time because he's motivated, and then he does them second time during the week, and then he starts to pull away, and he doesn't do them later on in the week. he kind of things get busy. He puts them off and he says, I'll do them next week. Now, he already has another booking in with the physio in 2 weeks' time. So the next week rolls around and he does them a little bit, and he notices, okay, well, I've done them 3 times and the pain isn't going away. It's still there. Even though it's not being completely honest with himself, but let's just use this as an example. He blames the diagnosis. It couldn't be the glutes not firing, because I've already worked on these exercises. I've been to this physio 2-3 times now. He's given me the same exercises and it's not fixing it. We're overlooking the fact there that you haven't actually, in this case, he hasn't done the exercises consistently enough to see a change. But let's not look at that yet, okay? So what he does is they blame the diagnosis. They say it's not the glutes aren't firing, and he decides then that he needs to go to a different physio. Perfect. Now, the thing about it is, there's 2 issues going on here. First off, the diagnosis itself of glutes aren't firing is not a diagnosis. That's a crazy diagnosis. It doesn't happen. Okay, but anyway. So that doesn't add up. The second thing is you're battling with Tony doesn't generally do the exercises that he's given. Okay, because he doesn't see the need in doing them. He's not motivated enough to do them. So when this happens, you basically focus on the wrong things. Okay, and you need to understand when you're dealing with a recurring flare-up, something that keeps happening, which is, as in Tony's case, it's happened for 2 years at a time here. Now, it's not that he just had a random back flare-up, but we forget to add up, okay, my back flared up in September, it flared up in November, it flared up in February, it flared up in March. Now, each time it flares up, we look for a new diagnosis. So let's say, with just natural history, the flare-up calms down. Now, this is where you start to get into the world of chronic injury. Is you get the flare-up, he does a couple of exercises, let's say they work for him, he finds a new physio, gives him a new diagnosis. The flare-up calms down naturally, because it does. There's a natural history with flare-ups. What you're trying to do is improve that natural history and then make sure that they don't happen again. That's what you're doing. But when you consistently get them, you get these crazy diagnosis of glutes aren't firing, it's your core is weak, and you get these kind of random diagnoses that have nothing to do with the injury, very little to do with the injury. They're signs of maybe how the body has reacted to the pain that it's feeling. You will then not relate that one flare-up is the same as the next flare-up, in that it flares up, it gets really bad, and then it calms down. Because when it calms down, we put it out of our mind and we stop thinking about it. So every time we get a new flare-up, we think we've done something wrong because we've got a new injury. But anyone who listens to this podcast for a while or follows me on Instagram knows that when you're looking at a chronic injury or a chronic back pain, it's neurologically driven. Okay, that's what we need to understand. Just because we have pain doesn't mean we have injury. Like, we can get a lot of pain with no injury, and it's really important to understand that. And that's why when you get these diagnoses of, okay, it's your weak glutes, it's overactive muscles, it's posture, it's not. It's especially when you're looking at an issue that is consistently flaring up. They're just signs of how the body reacts to that issue. That's a protective mechanism of the body. That's not a diagnosis. Or when you're looking at posture, that's generally something that you've picked up from your parents or somebody who you look up to. That's just generally the posture that you take on. Okay, so there's more to it than it's just, okay, that's the case. Weak glutes, another way of looking at that. First off, how do you test weak glutes? That's what I would ask. Because manual muscle tests that they do are not effective. They've proven that they're not effective, because if one person tests and the other person tests, and let's say the first person that tests is gymming, he's a power lifter, and the second person that tests is a 60-year-old nurse, then you can't exactly measure those against each other, because it's completely different. Because how they measure manual muscle tests is 0 to 5, and they say 5 is full strength and 0 is no strength, no activation. So that's me going on a little rant there. Basically, what I'm saying here is that the recurring or chronic issues are neurologically driven. If we can understand that, we can improve. Okay, it's so easy to find a new diagnosis if you want. And let's just follow on now. Let's follow Tony's story on. So let's say his September flare-up calms down after 6 weeks. He's going through the winter. He's getting deep into it. And now he gets another flare-up at the end of January, February time. Okay? This is March when I'm recording this. So he's getting it the end of February, March. Or end of January, February. He goes to a new practitioner. The new practitioner now tells him that it's because of his flat feet that he's getting back pain, and is able to show on a diagram perfectly how the flat feet that he's had since he was 4 years old is now causing his back pain at 38 years old because of the angle of the foot and how that changes the knee and how that changes at the hip and all of the other factors associated. Completely leaving out the idea that the body has adapted to any position that it's been in over the years. It's different if you sprain an ankle and then you get knee pain a week later. That's different because that's an acute change. But if you sprain your ankle when you're 10 years old and you're getting knee pain when you're 38 years old, that is not related. Okay, it's not related because it doesn't make sense. Because why didn't the body do it right away? Why didn't it kick up right away? So you need to look at a chronic issue is different than an acute issue. An acute issue is something that you get a mechanism of injury, it happens, and then you get something up the chain, kicks off. That's okay. But let's go with this diagnosis. So here they start working on the feet. Now the same thing, they have 3 sessions. It's over a 6-week period. And by the end of the 3 sessions, the pain, the natural history, which is the natural time that it takes a flare-up to calm down for a lot of people, if you're not doing anything with it at all and you just leave it as is, it's 6 weeks. So now the diagnosis has been confirmed that it was his flat feet that were causing his back pain. That's grand. Let's now, because he's just addressed the feet, and before that he addressed the glutes, so it's obviously 2 different ones. They're not related. In his mind, he's not connecting the 2 of them and saying, I'm getting the same back flare-up. He's just connected 2 different diagnoses when both of them are signs. None of them are actual cause. He gets another flare-up 10 weeks later. Okay, now he's saying, okay, I'm sick of this. I've had 2 different diagnoses. The best thing to do is I need to go back to a new doctor, or I need to go to a consultant, and I need to get an MRI because I need to really see what's going on here. Now, this is when the crack starts, is when you start going for an MRI for a chronic injury. Because if a chronic injury is neurologically driven and you go and you continue to look down the path of a biomechanical issue, and that's where you look at like the bones and the structures and the muscles and how that's causing it. And now we know that pain is not related to injury, and it rarely related to, well, obviously you can get pain with injury, but it's not related. You can get pain without injury is what I'm saying. But we continue to look at the biomechanical. Let's just see where this goes afterwards, okay? So you can continue to pick and choose, and different practitioners will continue to pick and choose different diagnoses for the issue that you're dealing with, and they will continue to look at it biomechanically and say that this is the thing. Now, you'll work on it for a few weeks or to a few months. The flare-up will subside, and then it will kick up again 3 months later, and the whole cycle starts again. So, all right, bam, new diagnosis again. This time it's your posture. Let's fix that. You wait out your 6 to 8 weeks, the pain subsides. Now a new flare-up happens, but it only happens 8 weeks. So before it was 10 to 12, now it's 8 weeks. So the time between the flare-ups is starting to get shorter and shorter and shorter. And the reason being is that we are not factoring in deconditioning to anything here. Because you're getting a new diagnosis, you're specifically targeting one area of the body, you're trying to fix that, and what's happening is the rest of the system is starting to get deconditioned because you're out of exercise, you're not moving around, your activity levels are dropping, and your nervous system is still on high alert all the time because nobody has told you that you can get pain without injury, and nobody is addressing the neurological side of the issue. Everyone is giving you a new diagnosis that's biomechanically driven, and it's not, if it was the case, all you would have to do is fix it once and it would be gone. When you sprain your ankle and you work on the rehab and you let the ligament heal, you don't start getting random ankle flare-ups in time to come. The ankle is fixed. Same with a hamstring. You don't start getting random hamstring flare-ups just on a Thursday because your work was really busy. You don't get them, but you can with a back issue. That's the thing. Or you can get it with a chronic issue. So we need to stop looking at that, because what's happening is you're kind of getting sold problems that and they're selling you on signs that need to be fixed when it's not actually the issue. So bang, right? So it's been 3 months, and as I said, now it's 8 weeks, and now you get a new issue. It's your posture. You're not factoring in deconditioning, so it's only 8 weeks. the time frame is getting shorter, you start to get a bit more afraid, because you're saying, okay, I'm looking back over the last year, I've had a low at my back. It feels like, and especially when you bring in recall, it feels like you've had pain the entire time when it's been in 6 to 8 week blocks. But it's very hard to differentiate between that, especially when you're dealing with it yourself. That's why it's important to look for someone else to help you with these things. And you were saying, all right, I'm dealing with the issue, I need to get an MRI, it keeps coming back, I want to make sure there's nothing severe in there, nothing bad that's making it worse. You have a load of fear around it. And Tony has a lot of fear around the issue that he's dealing with right now, because of the fact that he's gotten so many different diagnoses. He does, at the start he didn't do the work, and then he started doing the work, and now even though he's doing the work, it's improving for a short time, but it keeps flaring up again. Now here's where the real crack starts, okay? So Tony goes in and gets his MRI. Nobody mentions to Tony, it doesn't matter if you have a sore foot, a sore hip, a sore shoulder, or a sore wrist. If you go in at any stage and you get an MRI on your back, there's a 1 in 3 chance of you having a bulging disc with no pain, or with it. There's a 1 in 3 chance of you having a bulging disc. There's a 50% chance of you having degenerative disc disease. So as I said, if you went in with a sore foot and you got an MRI in your back just because, I don't know, for the crack, there's a 1 in 3 chance that that's going to come back with a bulging disc, even if you have no pain in your back at all. That's general population statistics, but no one says that to him. No one told Tony that when he went in. So it's the same as, like, it's similar to, let's say, going into a casino, and you let's say you have the money that you're going to put down for an MRI, whatever, 250 quid. I'm playing roulette at the casino, okay? I'm playing red or black, but this time there's a problem, because if it hits red, which is, it comes back and says you have a bulging disc, you then connect to that bulging disc, you double the amount of money that you have to continue paying, because then you have to go to a consultant, and then you have to get a surgery, if that's the case to what they do. Even though it didn't make a difference, you could go in, your sister could go in even if she had no back pain, and she would have a bulging disc. There's a 1 in 3 chance that she has a bulging disc. Your uncle could go in and there's a 50% chance that he has degenerative disc disease, depending on his age. I say 1 in 3 because that's over 30. As you increase in age, with over 40, over 50, the percentages increase massively. Like, if you are 50 years old and you have no signs of degenerative disc disease, okay, it's a funny name that they put on it, it's just degenerative, it just shows that it's wear and tear. That's amazing, because when you're 50 years old, there's nearly 100% chance that you're going to have it, with or without pain. So this is what I'm saying. So if your sister went in and got the MRI, and then your sister's MRI results, you gave that to your doctor, they would say, okay, you have a bulging disc, when it has nothing to do with it. So we need to stop relying on MRIs for these things, because they're not effective. Okay, they're not effective for chronic recurring injuries. The other thing is that if it hits red, it says you double your money, you go to consultant, you continue down that path. If it hits black, then you look for a new issue again. The fear increases, rises, you start to get blood tests. When this happens, the pain increases, because fear and pain are correlated. Anxiety and pain are correlated. Okay, all of these fear of movement, fear of what the diagnosis is, the unknown, conflict with someone in work, where you're fighting with somebody in work, or you fear to go in and meet your boss, is correlated with pain, more so than these MRI results are. Yet we continue to push the MRI. Now the thing is, when the fear rises, it becomes debilitating pain. We stop work, we stop moving, we avoid all activity because we don't want to make it worse. And we've been given all these other diagnoses in the past. Tony's sick of it. He's been given so many different diagnoses, but no one has ever mentioned to him, you can have pain without having injury. You don't need to get a new diagnosis for a back issue that's been going on for years. If you get a back flare-up that's happening every couple of months, the same issue, then it's important to look at the neurological side of things, because if you continue to look at the biomechanical, you will continue to get new diagnosis for an injury that is not neurologically, or that is neurologically driven. It's like, and now this is more of a kind of a morbid example. It would be like looking at somebody who's had a stroke. Now, when you get a stroke, they say a stroke is a cardiovascular issue that has neurological after effects. or consequences. Because when you get a stroke, it blocks arteries in the brain, and then the areas associated with the blood supply there that aren't the areas of the brain that aren't getting any blood supply start to die off. Okay, so that's why people lose the ability to walk, or they lose the ability to move in a lot of cases and think, depending on where the stroke happens. Now, it'd be like looking at that and saying to somebody, okay, your issue is that you're lacking leg strength. That's why you can't stand up. So we'll do leg extensions on a leg extension machine. Not knowing that the issue that they've been dealing with is actually in the brain. Now, there is, the interesting thing about this is, just to help people out with this case, specifically when it's a stroke, if you're dealing with a stroke patient, you can't just give them leg extensions to build up the strength of that muscle, because the brain needs to rewire so they can improve their ability to walk. You can get people back walking after a stroke. It's really, really interesting. Neuroplasticity in the brain starts to rewire and starts to figure out the movement again. But the only way you do that is actually putting them through the movement of practicing walking. And that's why you see people walking with the bars after they've had a stroke, and you don't see people going to the gym and doing leg extensions when they had a stroke, where you're sitting on a thing and kicking out your legs, because it's not a strength issue, it's a neurological issue. This is the same thing when you're looking at back pain. It's not a strength specific issue, even though strength can contribute, and working on strength can improve it, no question. But because it's a neurological issue, even if you improve the strength, you can still get flare-ups in time if you haven't dealt with the neurological burn spot on your let's say on your nervous system. And that's where people get mixed up, and that's what happens to people. And the funny thing is, I bet you could go to a physio, especially, let's say, the older ones, and I'm not knocking anyone, it's just that it's more of the research that's come out in the last 15 years, and they won't understand, they won't be able to explain this to you as well. They won't understand it as well, because it's kind of the research that's coming out now, or it is the research that's coming out now, but it has been coming out over the last few years. But the interesting thing is, if you look back at Chinese medicine, they talk about this idea of how other systems in the body actually cause it to kick up. So we need to start, instead of looking at the biomechanical, where you continue to look for new diagnoses, because if you want to, send me a picture of your back and I will give you a couple of diagnoses. I'll just say, you send me a picture and I'll say, the reason you have back pain is because you have scoliosis, you have winging scapula, it's because of your posture, because you're leaning to one side, one hip is higher than the other. All of these things are not diagnoses. What they are is they're signs of how somebody moves. And maybe you could say, okay, well, if we work on strengthening them, that may help overall. And it generally, if you work on strengthening in any case, it's going to help overall. If you do bicep curls, there's a big chance that your back is going to improve. Why? Because the activity of the body and the confidence of the body is improving. Okay, so there's a lot more to it. There's a lot more psychological and neurological. There's more of a psychological, neurological side to back issues than people ever want to admit, because I don't know why. It'd be different if it was before, if they said, right, like if you just said we need to address everything together here holistically and it will fix. But otherwise, people want a really simple, rational reason for their pain, where it's your fat feet is now causing your knee, which is causing your hip, which is causing your back. But for some reason, it's only your back that's taking it. Your hip, knee isn't giving you any trouble, and it has stopped at your back because it hasn't gone all the way up to your neck. You know, if you're going to be rational about these diagnoses, you have to be rational all the way through. When it's a neurological issue, it's very easy to be rational all the way through. You get a flare-up when your sensitivity on your nervous system increases. When that flares up, when it kicks off, when it fires off, you start to get a lot of pain and discomfort. The natural history of that to happen down is about 6 weeks. You can improve it though, and you can bring it back to 4, you can bring it back to 2, you can bring it back to a couple of days if you understand it and if you know how to work with it. But if you continue treating just signs, it's not going to work, because you need to treat the psychological, you need to treat the emotional. You need to work on those. You need to work on taking down pain sensitivity. Then you need to work on fixing the burn spot by increasing tolerance. And the strength exercises that you're given for the weak glutes will improve tolerance a little bit, but unless you understand that, okay, well, I need to push on more here, I actually sometimes need to get another flare up to improve this. And if you look at the next podcast after this one, the one that I did last week, I talk about creating strategic flare-ups to fix it. So if you join these two together, you're in a very good position to fix the issue that you're dealing with. These two podcasts, like, it's just about applying the principles and doing it over time, as opposed to getting the flare-up, waiting for it to calm down, and then deconditioning. The next one happens, the fear builds, the cycle continues, and then you get to that point that you can't do anything without having loads of pain. So that's why I'm putting out these podcasts, because I just think that the more awareness that we have around what's actually causing this, the better able we will be to fix it. Which leads me on to the next point, is that anyone who's interested in it, anyone who's dealing with the back pain or back issue, we are opening up the next round of our back pain back to exercise group on the 25th of March of this. Now, if you're listening to this after that date, just check the link in the description and you'll find out when the next cohort is actually kicking off. But the 25th of March, we're kicking off the back pain back to exercise group. If you want to get in, there's an early bird offer right now. It's €100 off the main price. So if you can click the link in the description, go in, sign up, you'll get access to all the materials, and then you'll jump into the group. And you generally, the people who sign up earlier have more of a head start on the group because they can get an understanding of it. They can apply all the principles, they can apply all the tactics and techniques and the strategies. They'll see what's working, what's not working for them. And then when the group kicks off, you'll have a way better idea of what to lean into and what to work on. And what we do in the group then is we do Q&As and we do live calls. And anytime you have questions, we have a community there as well to make sure that everyone's in the right path. And we can answer more specific ones. In the group itself, the goal is to get people back to running. In the group that's gone by, in our most recent one, we've had people getting back to gardening, we've had people getting back to weightlifting and getting back to enjoying even higher level activity. So check it out. I'll put the link in the description. If you're dealing with a back injury or a back issue that's recurrent, it's going on for 3 to 6 months or 5 to 10 years or whatever it is, and you want to learn more about what I've been talking about here, and you want to learn more about how to fix the neurological and not just continue looking for these new diagnoses and new signs, that group is definitely for you. The very last thing I would say also is if you enjoyed this podcast, please, I would love if you could rate it on Spotify. It goes a long way in promoting the podcast, in making sure that it goes up the rankings. I'm going to be getting more guests on with time, and the higher the podcast is ranked, the easier it is to get the guests. So literally, if you're on Spotify, you just scroll up to the top, hit follow, hit rate. I'd love if you could give it a 5-star rating. It really it goes a long way in improving it, and then with time I'll be able to get on bigger and bigger guests, and I'll be able to ask them hopefully the questions that you want me to ask them. So with time we will get there, but if you could please do that, I would love if you could rate it. Right now, I appreciate you listening. If you know anyone who would be interested in this podcast, pop it over to them. Right now though, I will let you all go, and I will chat to you all again next week. Have a good one.